Welcome to the webinar Management of Fibromyalgia in Europe. I am Gunilla Göran and chair of the European Network of Fibromyalgia Associations, ENFA. The survey we are talking about today is the first of its kind in Europe. It is estimated that there are approximately 50 million people in Europe who suffer from the disease FM, fibromyalgia. And the survey also shows that FM is still not recognized in most countries and that patients experience enormous difficulties due to lack of support, especially medical support. Over the 14 years of ENFA's existence, we have heard the reports of all member organizations from our network about their struggles on national levels. Although all reports are very similar, there is still no record at European level of these difficulties or achievements of each country. So through the form, we asked several key questions to our network members, which would help us to understand the state of the art of fibromyalgia in several European countries. We were able to get responses from 15 European countries. And to talk about the study a little bit more, the survey, we have invited a guest, ENFA board member Joana Vicente from Portugal. And we will continue to talk and like you to be involved in the chat so we can have a dialogue. About the study we conducted with our 22 national members. So please, Joana, welcome.
Hi, Gunilla. Thank you very much. Good morning, everyone. I'm very happy to be here to present our project. So I will be sharing my screen. If you have any questions, please write on the comments and we will see it after the presentation, and we will try to respond and maybe have a bit of a conversation about this issue, because as we're going to see, we need to do a lot more. So I will share my screen now. I hope you can see it. Okay. So before I start, I want to just explain about some facts about fibromyalgia, because they are going to be important throughout the presentation. So in the end, we can compare a bit about these facts and what the members said about the way that fibromyalgia is managed in their country. So some facts are that the World Health Organization recognized fibromyalgia. Keep in mind that this year the code changed. We have the new ICD-11 and we have a new code from the World Health Organization, but yeah, it's recognized. It's estimated that 4% of the European population suffers from fibromyalgia. About 80 to 90% of these patients are women, but men and children can be diagnosed as well. There are still no tests to detect this disease. It's recommended a combination of different types of drug and non-drug treatments. You can see the guidelines from EULAR or the American College of Rheumatology as well. You can see all of this explained. And as you know, it can be very debilitating. So keep in mind these facts during the presentation. So like Danila said, we created a survey that was filled out by our network members, our national organizations that are part of ENFA, and then we turn it into an ebook that is available for free in our website, when you can see all the all the responses from all the countries in more detail. Here I'm going to be very briefly in a general way to speak about the responses, but you can read all of them in the ebook. So these are the countries that responded to the survey. Some of them have two national organizations or more, and we are very grateful. And we hope to expand to other countries, even those the ones that are not members yet, because the objective here is to understand what's happened in European level. It's important to have this registry because it didn't exist, and if you want to do something, we need to have some kind of registry. So the results. Several national health systems and government do not recognize the existence of fibromyalgia, despite of what the World Health Organization says. This is sad. Some of the countries do recognize it. For example, Portugal. It recognizes fibromyalgia, but that doesn't mean that we have legal support of any kind of support. It just recognized and that's it. But some countries don't have that. So that said, of course, many health professionals still do not believe the existence of fibromyalgia. And this is very worrying because these have a lot of consequences on late diagnosis, late treatment, and it can deteriorate people's health, of course. So, but this is tricky because I believe, in my personal opinion, that because some health professionals are in the government, and if they don't believe in the existence of fibromyalgia, it's going to be really difficult for the government or the national systems recognize fibromyalgia itself because of this issue. So this is something that we, national organizations, European organizations, individual patients should work, creating awareness, talking about fibromyalgia. So we need to have a lot of work, all the stakeholders, not only the organizations itself. And for that, there is no legislation to support specifically people diagnosed with fibromyalgia in national or European level. There is still a lack of knowledge about fibromyalgia and how to treat it. And again, this has a lot of consequences in regards of seeking treatment and late diagnosis. Some countries do not have diagnostic and treatment guidelines, but they are available, but they don't use it. We have, for example, the guidelines written by EULAR and the American College of Rheumatology. Again, I can give you the example of Portugal. We use the American College of Rheumatology guidelines, but some countries do not even acknowledge that document. Well, our health system acknowledges the document, but that doesn't mean that the health professionals believe in fibromyalgia or use it. That's a different story. But yeah, some countries accept these documents or not, but mostly don't use these guidelines, criteria, or treatment for diagnostic or treatment. And like I said, diagnosis and access to treatment are very late because of all of this. Many patients can't obtain sick leave only to fibromyalgia. So if you're in a flare, for example, and you want to be some days at home because you're not feeling well, in some countries it's very difficult to obtain sick leave due to fibromyalgia itself. most of the countries don't recognize fibromyalgia as a cause of disability, and therefore these patients are unable to obtain support they need. Support regards of seeking healthcare, regards of financial support, because they can't have their expenses in the end of the month. For example, house, medication, food, it's too much. And if you are really sick and you can't work, it's really difficult, and most of the countries don't believe that FM it's really a cause of disability, but we know the reality, and it is in some people more than the others, but in the end it's a cause of disability, and we need the legislation to support the patients. Fibromyalgia is not considered a priority case in terms of healthcare, regardless of the patient's conditions. Well, I believe this is serious, but we have a lot of issues here in this topic. For example, there is not enough doctors for example, in some remote regions of the countries. There is a lack of rheumatologists, for example, and that's really a lack of knowledge about fibromyalgia itself, like we saw in the beginning. So this is a problem with a lot of problems inside in this when it's not recognized as a priority. And of course, because most of the countries don't believe it is a cause of the disability. It's difficult for these patients to have access to health insurance. It's practically impossible to have health insurance if you have fibromyalgia, just for fibromyalgia itself. I believe in Denmark that they have some kind of arrangement for health insurance regardless of fibromyalgia, but it's tricky, and they need to prove themselves all the time that they have fibromyalgia. So it's tricky, but no, just for fibromyalgia itself, it's really difficult. And like I said, much work is still needed to raise literacy and awareness for society in general, for the patients and health professionals. I believe this job needs to be done by all the national organizations, for us as European level, and of course in patient level, family level. We all need to do something. You don't need to be a part of an organization. Of course, it's better if you help your local organization, but you, in your individual self, in your life, you can always do some kind of awareness about fibromyalgia. Just speak about it. It's important. Educate people. It's important. And that's the job for everyone, not only for the organizations.
I think we, from the results of this survey, which is so important and only of its kind in Europe, we can understand what is missing, and so we can even adapt our plans for future activities to help our member associations work through their barriers at national level. And we at ENFA, we will work at the European level with the competent authorities, as we believe that the exposed information will have some impact on government officials, so that they are aware of the serious situation, even in many European countries, with the people diagnosed with FM. It's, as you said, Joana, it has a tremendous impact of the national health for the economic burden for the countries itself. And the associations of the national level can also use this survey to work together with the country's government, of course. And we have now, in recent years, have founded a scientific advisory committee with well-known international researchers and health carers in different levels.
Fields, yes.
Different fields, thank you. Sometimes lost words. And we will work together with them. And it seems as they, after their long research years, also get more and more determined to work with the patient organization and be a little bit more political, to work with and also try to influence the policymakers at the national health organizations, departments. That's what we really, really need to do now, I think. We have suffered for such many years. So this survey shows how people with fibromyalgia have a very low quality of life, and we can't have it like this any longer. So we are in ENFA with a committed board. We are really committed and engaged to do a lot of work now when we see how really bad it is in the different countries. And as you said, Joana, there are so many inequalities from the different European countries. So, and there is guidelines, as you also mentioned.
Yes, there is.
There is, yes.
And this just go to the website and download it, and you can adapt to your country. That it's simple, of course. Logistically, I don't know, but they exist, and if you are a health professional, you can see it on the EULAR website, you can see it on American College of Rheumatology website. You can find it, the information is there. So it's very important that health professionals and even patients can download these documents and, for example, show to your doctor in your next appointment to make them aware that this kind of documents exist. So, like I said, it's a job for everyone, and we need to give this information. And it's said that some of the countries don't have don't adapt these guidelines, for example, and it's said because can be a help to manage, help to as well to quantify the number of fibromyalgia patients there is in the health system of your country. So it can be of very beneficial, but it's something I really can understand. So
no, it's very hard, because the GPs, the doctors, the healthcare, they must see how the patients suffer. They must see that, and I think from their education and the sometimes lifelong clinic work, they understand, and they must know. I think there's their point of helping the patients, and they have not done that. We need to see that, and we need to take an option that they have not done that properly. There's so many people suffer from fibromyalgia, and nowadays, as the research has come such a long way, it has about fibromyalgia, we can also see that it's we name it nowadays as a biopsychological social disease. So if we just had one pill, one medicine that we could take to suffer our pain, it was beautiful, but it's not like that. So the GPs, the healthcare, the other stakeholders, and the national health governments, they have to see their patient. They have to see them now. It's
Yes.
many million.
Yes, and it's very difficult. I can tell you, for example, that in Portugal, in my organization, we conducted a study just really because of that invalidation that people suffer with rheumatic diseases suffer from invalidation, and we reported that, of course, fibromyalgia was on top. It was number one. That were the patients that suffer mostly from all the rheumatic diseases, that suffers most of this kind of invalidation from health professionals. And they said, because you're going in pain, we are going vulnerable, we are going in a really bad state. When you go to the doctor, you're not going there to say, look, I'm fine, I'm just come here to say hello. When you go to the doctor, you're not feeling well. So, and it's really difficult for me to understand, and I experienced that in firsthand, when a doctor really don't believe believe in you, and there's a really lack of respect and empathy. One thing is, oh, I don't understand fibromyalgia. You can say, really, I don't believe it, but but I will going to pass you to another colleague that maybe can help you. I don't understand it is when you cross the line to when you there is a lack of respect for the patient in front of you, and I really can understand that. And the problem is, this goes to a political level, because many of these health professionals are in the government positions and everything, and of course they will say that fibromyalgia doesn't exist and is everything that we know, that we hear. So this is said, this is going to be, and it is a long battle. And like I said, it's important that we all have something a part of this. Not only, don't expect just the organizations to do all the work. Us in the individual level, we needed to do as well. And it's important. You talked a bit about patient involvement. I'm very passionate about it, and it's really important us as patients to see the important it is to be involved in scientific investigations, research. So if we are involved, they know the experience firsthand. They don't just think how it is. They have someone there that is telling them, no, this is what's happening, this is how we feel. So it's important. It's difficult. It's difficult. Here in Portugal, I see it's getting better over the years, but it needs to come from us as well as organizations to push the health professionals towards us and invite them to do stuff like we did, for example, here in ENFA with the scientific advisory committee, because it's important to have this group of health professionals, not only rheumatology, and nurses, psychologists, everyone, because ideally we should have a multidisciplinary treatment, but we don't. But it's important that we have this team that and we can have this kind of projects and create all the means for us to go to European Parliament and so on to talk about fibromyalgia, to give data, because if we don't give data, it's going to be very difficult for them to take us seriously. But you really need to show numbers. It's not enough to go knock on the door and say, look, we have this problem, you should do this. No, it's not how it works. We need to show that we have a problem, and we need to say, look, we want to work together, and this is how we should work, and this is what we should do, what we can do together. It's not most people think is go to the national government or whatever and knock on the door and say, look, we have this problem, you need to do this. It's not that simple.
No, it's not simple at all. But I think, at least in Sweden, I'm from Sweden, we have come a little bit ahead, sorry, ahead now, even if fibromyalgia is not considered as a disability disease at all. But since the late last year, no, 2 years back, I have been in a group with the professional healthcare and researchers as a patient representative to work with guidelines for pain patients in healthcare. And it has been a very hard work, and we are 2 patient representatives, and we have been able to written down what we as patients have to meet when we have this pain, and sometimes it's difficult for the doctors to see what kind of disease you have and so on. We all know about this situation, and now the work is done. We have completed guidelines, Swedish guidelines for taking care of pain patients. And now is the hardest work, I think, is the implementation of this work, because there's a lot of work. There's an algorithm, how you, as a GP, when you meet a pain patient, how you could act and react, and what kind of levels, as you said, Joana, the multimodal treatment is there, and how the levels in the healthcare itself have to work together and find out the best resolution for each patient. And we are now having, as we call it, rehab coordinator that should support the patients through all these different kind of levels that we have to go through. You know, you can be sent to a physiotherapist, you can be sent to a psychiatrist, you can be sent to any in the healthcare that should support you. But if you are in pain, there's so much going on beside healthcare, what they do, what they want to do with you. And this person, a licensed person, an educated person, should support you and with what you have to do now, and give you understanding why you should, maybe if you want to have a dialogue with the patients. So if you don't have the dialogue, if you don't are on the same level, how your future should be or can be, there's the rehabilitation. It's lack of commitment from the patient as well. You have to understand what you will be, what will happen to you through all these kind of different rehabilitations actions, and that one very important thing. I know, Joana, you have done in Portugal a study about how you are treated as a pain patient from the healthcare when you come for the first meeting. And that is also so important that we have to work with this. How is the first meeting? Does the doctor listening to you? Does he believe you? Now I said he. Does the doctor believe you?
Yes.
and things like that. That's the really, really first step for me as a patient to have trust in the doctor, so we can go the same path away to give my disease and myself a better life, I think.
Yes, of course, but there is a lot of problems regarding healthcare, the lack of time to see each patient, the big volume of patients because there is a lack of doctors in some places. We have a really big problem here in Portugal with the GPs. Now we have a lack of GPs. We have a lack of rheumatology. We have a lack now. All the maternity wards are closing now, so this is starting to be really difficult, not only for fibromyalgia patients. In regards legislation, I want to just add something because it's mostly every week that someone asks me, it's why don't we do this and that? Like I told you, we can't go knock on the door and say
No.
do this for us. And the other problem is, of course, every country is independent and have their own legislation, but we have guidelines from the European Union, so some things are really difficult to change because of that. It's not only a national problem, it's also a European problem. So of course we don't give up, and we always try to change things. For example, we are now trying to understand how in my country it's going to use the new ICD classification for fibromyalgia, and regardless of that, each country decides how to use the code. Portugal is going to do something, Sweden is going to do something else, Italy, Spain are going to do something else, because there is different categories, and each country will choose in which category they will choose to apply the code. For example, health insurance, healthcare, work, disability, and it's not going to be the same for for each country. So and you can see that on the World Health Organization website. So yeah, it's not easy, and there is a lot of problems regarding healthcare as well, the lack of doctors, the lack of time. But my biggest problem is the lack of respect for patients that I don't understand.
Yeah, I agree with you, Joana. It's a tremendous big question, the lack of respect for the patient, but the patients tell the doctors they don't believe it, and that it's well, I can't find word for it, because it's such a strange, awkward thing. Yes,
I want to give a bit of responsibility to the patient as well, because if you go to the doctor, if you see we have a little bit of time, please ask all the questions that you want to ask. Don't be afraid, because it's your body, it's you are going to pay for it, it's you that is going to pay for the medication, it's you that is going to do the exams. Please ask all the questions. If you are mistreated, you can report to the health I don't know how it's working on your country, but we can report on the hospitals, for example, and in the national level that the doctor mistreated us, because this is their work. And of course we have bad days, but that's not the justification to mistreat some people. And serious things can happen in the patient consultation. So don't I know it's a bit frightened, but if you need to speak up wherever, and use all the little rights that you have, because you have the rights to say something when I don't. I'm sorry. I'm tired. It's the morning here, and the words just.
But Johanna, yes, I agree with you about the role we have as a patients. I think also we should give ourselves, as you say, a little more encourage. We need to step up from the passive patient to the active patient.
Yes.
And I have some lectures for health professionals that are have some education in pain, in pain, and they are different professionals, and I talk about the pre-understanding of the meeting, the first meeting then, and I would like the patient to ask before I come to the first meeting or the meeting to give me from the doctor how long will this meeting be, what is the doctor's part of it, what will the doctor ask me about, and the time for me to ask questions as well. And if I can prepare mentally about these and recognize how long will the bus take there, will I walk or something like that. So I will be prepared both physically and also mentally. And then I can always, as it in Sweden as well, we can have someone coming with us to the meeting. So I, as a patient,
and you can write down all the questions.
Yes.
So you can, so you don't forget when you go there.
Yeah.
For example, you need to go prepared. So this is a responsibility for everyone has some kind of responsibility, and as patient as well, we can do these little things in a personal level. And I need to say this again, please join your local organization.
Yes.
And help your local organization, because we need your help. I believe that in Sweden you need help as well. It's not only
supporting. Supporting.
We all need the volunteers to help us, because if we are if we are united, we have more power to go forward with these things, because like we are seeing, it's very difficult to work in let's say legal level, political level regards of fibromyalgia. It's really, really difficult. So the more the merrier in this case.
I would like to point out, maybe we are coming to end up this important topics for today, and I would like you firstly I would like to thank you, Joana, that you could take the time for this Saturday morning webinar, and I hope we have showed the survey, and it's so important, and it's open for everyone to download, as you said, Joana. And
I will put the link of the ebook on the comments, and you can download it for free on our website, and you can read in more detail of each country what they said. I think it's, and you, of course, like Anila said, you can use it whatever the way that you want. So please feel free to use the ebook, to read it, to share it, and we will appreciate it.
That is wonderful, and also for the national organization as well as for the European level, it's very, very important that there are platforms where patients can share their experience and reflections, not to feel I'm alone. So national organizations are doing a fantastic work to include patients and to support them as well. And in the end now, however, I would like to remind you, as Johanna have mentioned before, the EULA guidelines for fibromyalgia. Have them in your hand if you need to do that when you go to the doctors or other healthcare professionals. And the recently revised World Health Organization classification of diseases, ICD-11, where fibromyalgia now has the code MG 30.01. And we know that there is a lot to work on in the various countries of Europe. It has shown here with our survey. It is a long process for all patients with fibromyalgia to receive help, good treatment, a diagnosis, and rehabilitation. We need to be persistent and strengthen our cooperation for a better future for fibromyalgia patients. And thank you so much, Joana, for today.
Gunilla, before we finish, there is 2 questions here that I want to respond really quickly.
Yes, thank you.
If FM is not recognized by the insurance, should not be insurance premium we pay be less? Well,
sorry, I didn't hear the latest words.
If FM is not recognized by the insurer, should not be the insurance premium we pay be less? Technically, you should, but the problem is if they don't, sorry, I'm really tired. If they don't recognize fibromyalgia, it doesn't exist in the insurance.
No.
So basically, if it doesn't exist, you will pay the plan that you choose. So I don't know how to explain it. And the other question is, or did you mean referrals to specialists are harder? Yes, referrals are harder as well. For example, here in Portugal, and I believe it's the same problem for every country, we have a lack of rheumatologists, and we need to wait months, years, sometimes for a consultation. Not only for rheumatology, for all the specialties as well.
We have some pain clinics that work in the multimodal model, and you can refer yourself to these clinics. There are not very many, and normally they are situated at the university hospitals. And but in Stockholm, for instance, we have 2 clinics, or 3 pain clinics, and you can refer yourself to these clinics. And
that's in the public system, or it's private? Because that's another...
It's the public system. In the public system, some are half private and half in the public system, but you always pay the cost as you do in the public service. And for the security system here in Sweden, for a couple of years, or more than a couple of years, maybe 5-6 years, fibromyalgia have often been described as a stress disorder, and then you get a payment from the Social Security.
It's different if you go privately and if you go to the public. Of course, privately it's quicker, but you pay a lot more, of course. Regarding referral in the public system, it's very difficult because that's a long waiting list. And in some areas there are a lack of doctors, so people need to maybe do like 3 hours travel to go to a doctor, maybe. And it's
true. That's true.
It's really difficult. And before we say our goodbyes, I want to give a shout out to Croatia, Spain, Serbia, Italy, Malta, Belgium, Slovenia, hello everyone, and I want to thank everyone who came here today to our first webinar. I hope, Gunilla, that we will be able to do more.
Yes.
And thank you very much for the invitation. It's always a pleasure to talk to you and to present this project. I hope in the future that we can expand to all the countries. So if you're living in a country that it wasn't on the map that the map of the country that responded, please contact us, because we really want to create a European register, not only a FOS member registry.
We want your voices. We want
Yes.
your voices. We will become stronger and,
Yes, so
cooperate. Yes.
thank you very much, and I hope to see you next time.
Thank you. Goodbye. Have
Thank
a good
you.
Saturday.
Goodbye.
Bye.
Oh, and this video will be available forever here on Facebook, and we will post it as well on YouTube. You can always rewatch